Welcome, Kate Sanford. We are going to be talking to you about your presentation for the State of Therapy Conference on September 26th at Clark University. And you are going to be presenting on federal laws in the therapy room, what therapists need to know.
Yes, definitely.
So, is there a lot that we need to know about the federal laws?
Yes. So family therapists especially know how important systems are. We work in systems, we live and die in system. The big system that sits above us, above our families, above the insurances we take are the federal laws. And so while we may not be front and center to this federal laws, they do impact how we do the work that we do and what our families and couples and individuals are bringing to the table. And now more than ever, the current federal administration has brought a dizzying array of changes that have upended how healthcare works. And by all indications, they are just getting started. And for therapists to be able to survive and thrive and be the valuable co-journey person with the people they work with, it's important to understand what the system is and what it could possibly mean for us.
Wonderful. This is great information. Do you intend to present some of these laws that are changing us and impacting us already?
Yeah, so I think we've already started to see some of the impacts. I know that a lot of therapists have been watching very carefully, looking at how the current federal administration has been looking at issues that are impact what they call woke DEI or unlawful DEI. They're really looking at how diversity may hinder what their preferred dynamics are. And so while executive orders don't have force of law, what we are starting to see is the federal agencies are starting to enforce that. And so we're already seeing things that are impact reproductive health and the privacy of reproductive health. We are seeing things that impact how individuals can access gender affirming care. And I'm not just talking about for LGBTQ. IA individuals, but also anybody who is looking to have some sort of control over their own reproductive health. Those rules are already starting to change. We are already starting to see changes with this Make America Healthy initiative and what they are looking for around how we make decisions and who is making decisions about what are the right things for us. And while lots of times people may think that touches on physical health, again, we know that physical health, mental health, and family health are all deeply intertwined. So these things are showing up in the therapy room, and I expect that they are going to continue to show up in the therapy room.
Okay, we really need to remain alert. Do you have um, ideas for us and how we can sort of stay on top of this tsunami of new laws and regs?
Yeah, I certainly wouldn't to sit there and read executive orders, federal law all day, every day is certainly not healthy. And I don't enjoy doing it, and I slightly get paid to do it. But there is an element of where there are listservs that you can sign up for and learn about the things that are important to you, and that there are also things around how you can have your voice heard for federal laws. So, but lots of times before a federal law goes into effect, they have a notice about how they propose to do it when they solicit feedback. And too often, therapists either aren't aware of that or don't give the feedback. And so there's a chance for us to have advocacy and to have a conversation and to be a voice. So we're going to talk about where some of these things can be found and how therapists can engage in that.
Wow, this is really important for this information to get out to the community. Um, what in particular are there, you've mentioned so many things that your workshop is going to be providing. Is there something in particular or a general takeaway or goal that you want participants to walk away with?
I want therapists to know how to find the information, how to digest the information, to understand what it could possibly mean, and then when they are able to do advocacy, what would that look like and what are the concrete steps? Because again, we've been more or less lucky that things have, over the years, we've seen more and more rights and more recognition, and that has all changed. And so things that we didn't have to worry about under the Biden administration we now have to worry about. And so I want to make sure everybody knows how to do that, and to do the things that they need to, because I don't want anybody to be the government's looking, and I don't want any of us to be the ones who are being targeted.